Hi, this is Dr. Saxena, and I've been talking on some things which we try to work it out, and namely trying to work it out with something like innovative solutions for some chronic health conditions. We are trying to aim at the root causes. See, I just want to kind of give you a small intro what we are trying to work it out here. Ever wondered about the major causes of death? Do you know that 8 of 10 people will die from either a heart attack or cancer cause? Before looking at the cause of death cause, look at what causes disease. Cancer and heart health issues have been virtually ignored by the great majority of the cancer. You need to look at a disease not as a cause of death. If we are to look at the cause of cancer or what causes heart problems, would it surprise you to learn that toxicity, especially exposure to toxic substances that equate to chronic poisoning, not only the disease but are responsible for all the chronic diseases? The cause of the disease we want to address. We are not just interested in cause of the deaths. We need to know what is this happening because of this toxicity or this chronic poisoning leading to all this chronic disease. If we just look at the heart, for instance, the questions that arise are: what type of toxicity could possibly cause heart symptoms which lead to chronic heart disease, coronary heart disease? After all, the heart disease symptoms are not related to the tissues of the toxicity. If they are related to the toxicity, the toxicology specialist would be able to reverse the heart disease. The answer to that is yes. In fact, properly trained toxicology specialists can do exactly the same. So I present something which I try to, because of my involvement with my clinical mental toxicology, board certified clinical mental toxicologist, as well as my radiology and my MBBS, this amalgamation gives me try a different approach for your chronic disease. And as an integrative doctor, always I have to say to everyone that I would like to use the best of both the worlds. Is it a alternative medicine or a mainstream medicine? I don't care, because both the things gives the best combination for the patients, and my patients are smiling with all they have seen, whatever things. So I want you to understand these are some of the cutting edge treatments which we try to follow here, and trying to work out something on trying to work with the biochemistry and trying to correct the physiology is our basic concept. Almost there are a lot of studies showing heavy metals like lead, arsenic, mercury, plastics, bisphenol. These are all the things which are related, associated with various medical conditions, published in all major medical journals. But it's totally ignored by the media and the vast majority of the people practicing medicine. The heavy metal issue, however, is not just limited, for example, lead poisoning in heart disease or mercury poisoning in autism. It goes beyond heavy metals and deals with the role of chemicals and their activity in cancer patients, and how this toxic symptom chemicals create a toxic chemical environment which is hazardous for our children, leading to something like autism, ADHD, asthma, delayed slow learners. So my focus is not only just with autism but all chronic diseases including heart disease, cancer, stroke, diabetes, Alzheimer's, where I believe these chemicals and metals which are toxic to the biological system produce a thing called oxidative stress or oxidative injury. So if we are able to reduce that oxidative stress by trying to clean up the process, things are getting much better. People are getting really better. I don't want to get into the controversy of the word cure and all that, but people are being managed in a proper way. So, welcome to my thing, which is integrative medicine, where we are trying to not just using conventional medicine that looks beyond that. Conventional medicine doesn't look beyond a point, whereas this integrative medicine, we are looking at the whole patient as a whole, surveys each aspects of the patient's health and involves the patient in treatment procedure. And in the sense, we try to make them equally responsible. They need to follow a diet, they need to follow some good practices, which they have to follow a diurnal rhythm, they should sleep at proper time. So many simple stuff we try to work it out along with that. So all these things with integrative medicine, they are helping the immunity to get a boost. If the immunity is increased, the body becomes stronger from within and fight to get rid of the ailments it has. So sometimes I say integrative medicine doesn't cure a person from certain illness, but rather cures the whole patient from every possible disease. This is my kind of, I can with conviction I can say it can cure the whole patient from every possible disease. These people, they don't get into problems. So this is the basic thing which we are trying to work it out. And yes, we do a simple kind of there is a process which we follow, and wherein we are it's like a trying to get the best of both the things, but we rely on a lot of tests and all that. We try to work on some toxic metals and all that tests based on what is the kind of person's inherent oxidative status. We try to look into that and start working on that. That is treating root cause. Thank you.